Thank you for having me. My name is Atume Divine Butler. I'm a medical doctor and internist practicing at the Bingo Baptist Hospital. Bingo Baptist Hospital is well known around the country for its excellence, and is one of the reasons I chose to work in this hospital. I rejected the government job because I strongly believe that in a public hospital, they don't give the care that I want to assist and promote like they do in this hospital. I have been working here now for 13 years and above. I do enjoy working there. Um, it's been long that a war break out here in our own part of the country since 2016. Um, our country is divided into two. Was colonized by the British and the French. We have 10 regions, and two regions speak English, and 8 regions speak French. I am on the side where we speak English, and for some time now, with the leadership that is predominantly francophones, they call it. Um, the people from my own area have been complaining of marginalization. They've been complaining for a very long time, and the government did not listen to them. It used brutal force against these people, and for that reason, they took up arms. In 2016, there has been an ongoing war fighting in our area, and people have been killed. More than 4,000 have lost their lives, property, as such. So our hospital is located in an area um, that is very difficult to access. There are roadblocks, both from the government forces and from the separatist side, that cause trouble to us and to the patients. With the coming of this war, some people decided to leave, and with the coming of COVID-19 in our area, we had our first case in 2020, late 2020. Um, Knowing what COVID-19 is, some people too decided to leave. Um, our hospital has a working capacity of around 800 staff in the hospital. And they are currently developing a bunker, building a bunker that is going to house radiotherapy machine, which will be the third and probably the best in the country, where care is provided with some passion that I like to join. So, coming to promote quality healthcare, care that befits or what the people want, you know, that they might derive some satisfaction from such care. I thought that I could only give in such a hospital, a mission hospital like this one, and that has been my drive. I have been looking at the care and I've been wondering on how it could improve. I've had several studies that have improved uh, my level of care in that light. So when I was introduced to acquire, that was what I wanted and how I wanted to go, and so I decided to join fully and assist in that light. In this case, I want to talk about my life and how I think assisting in quality care is important for me. A long time ago, we had this patient who came in. He came in after moving several hospitals around the country, He came to us. He was sick. He had seen several professors. We just wonder why, after seeing professors, he came to our hospital again. But as it will happen, even a junior resident was able to identify what was wrong with the patient without any difficulty in investigations. It didn't take long. We had the patient on treatment. This patient was he just had an X-ray, and it was clear that he had TB. They did a confirmation test that showed this patient had TB. He was started on TB treatment for this patient. We had another one who came in. You know, he came in as a caregiver, um, and just asked that we should check him. Um, as God will make it, an ultrasound was ordered, and in the ultrasound found a mass in the kidney. Um, we immediately ordered for a nephrectomy, which he accepted. The kidney was taken out, and he found out that he had cancer in situ. This is how this man was treated. We definitely know how dangerous kidney cancer it is. This is how this man was treated. This is the kind of motivations I like to stay and help. We do break difficult diagnoses in our hospitals that have gone around many countries, many side of the country, and we help in just practicing quality medicine. You bring out the diagnosis for the patient around the country. I fear to say it because the population is going through a lot of problems as concerns medicines. I don't think that they receive quality healthcare. We know that quality healthcare is cheaper than unnecessary healthcare that is provided out of here around our country. People do really funny things and get away with it. In our country, there is no control. That is one of the reasons that I'm in bingo, and that is one of the reasons that I joined Acquire fully to see how I can promote and why not. Currently, we train residents. I try to instill in them and let them really care with passion. When you care with passion, you will work hard to promote quality care, care that is cheaper than because when you see a situation that has been mishandled along patients pain unnecessarily before they arrive to us, and usually some after spending almost all their money before they come to bingo, sometimes they are somebody tells them to just go to bingo, that they will treat without asking money. um, the kind of group I want to join, treating the patient as a patient, though it's a problem though, because um, payments are done from what patients pay, and they pay out of the pocket. You can imagine how difficult that is, especially some who come here and the diagnosis are made that really will take them money to treat. Okay, so my journey here in Mingo Baptist Hospital and in our country is to encourage and see how healthcare um, could be of a certain standard like the West. That is what we teach our residents here at Mingo Baptist Hospital. And joining acquire and trying to inquire and know how we could help assist in staff satisfaction in our hospital. We definitely know that a happy staff working in a happy environment, that staff will give good quality health to the patients that come to him or her. So for that reason, we launched this in our hospital, and we let them fill in boxes with papers of different colors depending on how their day was. And we had what makes your day. We ask in a round table discussion, we ask them what makes their day, and they talked about it by writing on pieces of papers that we stick them on cardboards at the nursing stations. This was done both in the ICU and the men's ward, and some of them brought really important issues like issues of communication, issues of late salary, issues of doctors not following them, issues of allowances, issues of um, the environment that they are working in and how difficult, in a war zone, and then COVID, and then all those negative things make them unhappy. There were some that we looked on how to handle them, especially like for communication. We sent out some teams uh, regularly to go and talk with them and advise them how to the importance of communication and closed loops in medicines, how important it is. Um, we also send some people to talk on the issues of late salary. We send some people to talk on the issue of making the administration understand about inequality that the staffs were getting and how it was hurting them. We followed this and we looked at how their days were changing. We did note that some of the problems they mentioned in the second sitting we are absent. The problems we mentioned in the first our first discussion, we are absent in the second discussion. So we definitely thought that there was an improvement that happened from our interventions. And anyway, given that we are in the war zone, basically, COVID is gone, but the war is there. Around the country, people are afraid. In Africa, recently there have been a lot of coups. There have been trying to remove dictators. Um, our country actually is in fear right now, but healthcare must continue. With health, we definitely know that when people are running out, you have to get in to help them, and helping them properly is my goal. Helping them in a way that is of a better quality than what they might have had elsewhere is something that I plan to work on really hard. So this for this I'll uh, work on making a satisfaction a goal for the patients as they come to our institution. Thank you.